Step-by-step hijama. 1. Sanitize massage table and surrounding area. This must be done with an alcohol-based wipe or cleaner. When cleaning the massage table, start from the top and work in an S-shaped direction down. Once done, roll couch roll onto the massage table. 2. Next, it's time to sanitize yourself. Wash your hands following the WHO guidelines and wear your apron or scrubs. 3. Ensure any loose garments and hair are tucked in or tied back. 4. All equipment for the session should be readily available on a sterilized trolley or tray. Ensure to have a clinical waste bag to dispose of all hazardous waste. It is best practice to have access to a first aid kit in case of emergency. All therapists must wear medical-grade gloves. Best to avoid latex gloves, as it may cause an allergic reaction for some. It is highly recommended to use nitrile or vinyl gloves. 5. Once you have consulted with your client and decided on the points, they will lay down on the table. It is good practice to clean the surface of the skin using an antiseptic wipe. 6. You will start off with a gentle massage. You may use any nut-free oils. The most ideal is olive oil blended with black seed oil. Some skin may be irritated by oils, so you can use an aqueous cream or advise them to bring in a moisturizer of their own, such as Aveeno. 'The cups used must be BPA-free and be in a sterile covering. 7. For clients seeking massage cupping, you may need extra oil ointment. You will place a cup and follow it by 2 to 3 half pumps. Gently glide across the surface of the body or area of inflammation for 2 to 5 minutes, or longer if you offer it as an individual package. 8. The next step will be static dry cupping. This requires 3 half pumps, and the cup is left on the client's back for 5 to 7 minutes. If your client is able to tolerate more pumps, you can do so. Each additional pump must be made in half pumps. 9. Remove the cup by pulling the valve at the top of the cup. The cup can be placed on top of another cup if it's convenient. Cups can also be placed on a sterile surface, such as the massage table or trolley. Use pre-injection wipes. Cleanse the area of the ecchymosis where incisions will be made. Following this, incisions may be made. Ensure to stretch the skin and gently create incisions with adequate spacing. Incisions must be linear. There must be approximately 1 centimeter gap between each incision going across and 1 centimeter gap between each new row of incisions that will be made. The incisions will begin to let blood, and the cup will stay on for as long as the bleeding continues. You may apply an additional half pump after a few minutes to check if the bleeding has stopped. If you feel the bleeding has not stopped, you can reapply the cup and pump again. You will notice a change in colour over the areas that have been cupped. This is called an ecchymosis. (13) In order to remove the cups, you are required to use tissues, extra if there's heavy bleeding. There are 2 methods. The first way is to completely enclose the cup with a tissue, lift valve, and push the blood inwards so all excess blood is absorbed. Dispose cups and tissues into a clinical waste bag. The bin must be a pedal bin in order to avoid cross-contamination. In cases where the bleeding is heavier or in a slanted position, such as shoulders, you can release the valve and then drag the cup across the back and to the side. Apply pressure and then scoop the cup in an upwards direction. If you are concerned about a spillage, you can place dry tissue wipes around the area you are removing the cups from. To clear the incisions, put oil or ointment onto a tissue or cotton pad and gently wipe over the incisions to collect any dry blood. (15) Once the blood has been removed, you may clean the surrounding area with water wipes, avoiding the incisions.